All right. Hello. I love doing this with a mask on. Let me just state that at the outset. But we'll deal with the situation that we're in the best we can. This is about mounting models in the laboratory setting. So you have taken the final impression. You've done a full arch impression. You've sent that to the laboratory, and the laboratory has sent back to you a solid model. And in this case, it's a preparation tooth number 18. So a full arch impression was made. The student kept the upper arch and trimmed that. They also took a bite registration, and they took a face bow record. And so with this information, this all stayed here at the school. There was no reason to send any of this right here to the laboratory. The only thing that goes to the laboratory in the beginning is the impression that makes this solid model. The reason we have well, there's several reasons that we have the laboratory do that. The first pour of that PBS impression is used for making the die model. That's the most accurate pour. And then the second pour is used for making the solid model. So the laboratory can be working with the die model while the solid model comes back for the mounting. And then once that's done, we send all of this to the laboratory. So the first thing we want to do is scrutinize these models for blebs and bubbles and anything that would be an imperfection, especially in an area where it would detract from the accuracy. So as we look at this, this may seem insignificant, but I can see some little bubbles right down in the central groove on, what is that, tooth number 14. So we'll remove those like that. There's a little bubble, that's a little easier to see, that one right there. We'll get that out of the way. That bubble right there could easily interfere if the occlusion is anywhere near that. So we want to make sure and get rid of those little bubbles. Those little bubbles, there's more right there. These little bubbles, if they're left on the cast with the other model, it will create an inaccuracy. And what will happen is the crown or bridge or whatever it is that you're having made will be high. It'll be tall and it won't fit. So let's put a little compressed air on that. And now we'll look at it again and scrutinize it. This right there, I can see a place that might be a little high right in there. That's probably right where those lower incisors touch. When you're removing these imperfections, you want to, if you're going to error, you're going to over remove. You're going to take off more than what would be there. And that right there looks like a pretty good sized bubble. We're going to take a little more off there. And the reason for that is you don't want any imperfection that's up above reality is going to make the mounting high. In other words, it'll separate the models further than they are clinically. And that just takes valuable clinic time away from you when it's time to deliver the case. You want them to fit. You don't want the crown to be high. You don't want it to be low either. But if you leave any of those blebs, and they happen to be where there's interaction between the models, you will have a high crown. So the reason for taking a little more, if you're going to error again, than less, is there's plenty of places where these casts interact with each other. And in other words, if you over remove a bleb, there's probably a place right next to it that is very accurate, and it allows those areas to interact with one another and correctly orient your cast. And my mask is moving down my face because of my whiskers. I don't know whether you other males who shave your face have that problem, but I do. Okay, so let's look at this other cast now. And again, the main ones that you're concerned with are going to be on the occlusals, even on the preparation. So we have to make sure, I'm not going to take anything off this preparation yet. I'm going to compare it to the bite record, but I can definitely see that one, that one, that one, a little bit over here. You can see those that need to be removed. So let's take those off. And again, I'm using a small discoid cleoid. A Tanner Carver works nicely for this also. Just something that you can kind of groom these casts with. That is also a bleb right there. That's a positive bubble in that fissure. So let's take that off. Look at the incisal edges. Make sure that those don't have any irregularities that are going to cause mounting errors. A little bit right there. Again, you might think that I'm being a little too particular here, but that is not the case. If it sticks up and is positive and is an error, it will create an error in your mounting. So, we got a little bit over here now. You want to look at these from all directions. I don't know whether you can see those or not, but right on that buccal groove. So we'll take those off too. Again, the occlusal surfacers are the main ones that you want to scrutinize this way, because that's where the action is with the mounting of models. So now we want to take this bite record, which is correctly done just over the prepared tooth, but we have way too much information, don't we? There's no way that these little fins are going to go down into the embrasures in the opposing cast, because a cast does not pick up. Because a cast will not pick up the accuracy of that PVS fin in the occlusal embrasure. So we want to trim that off. Otherwise, this bite record will also cause the mounting to be high. So that's the next area that is very, very critical. So we'll take off and leave just the cusp tips, basically. So I took that interproximal fin off. I took off the central fossa area. It's okay if your bite record touches the adjacent tooth. It just can't come up onto the occlusal surface of the adjacent tooth. So we'll take this off like that. So we still have that proximal contact. That helps hold the bite record in place, but we don't have any material that's going up onto the occlusal surface. And now we'll trim the preparation side. Again, very similar to the way we did the other side. We just want the tip of the preparation. That's almost a little bit too much still. And now what we'll do, this is just extra over here. So now what we want to do is try this on individually. I can already tell I need to trim this because this is touching. I should leave it in place just to show you. So anything that touches the soft tissue part of the model is also to be avoided. So you need to trim that off. So we'll trim off this area right back on the distal, right there. And then we'll try this back on our preparation, and it's looking pretty good. You want to look for gaps. You want to look for anything where it's going to want to move or not completely seat. And this is the point at which I will really look now at these irregularities right along that central groove area. I think they're part of the preparation, and if they show up, and they do, they show up in the bite record, so we can leave those alone. If the bite record did not show those imperfections, then we would take those imperfections off, just like you did blebs, off of the prepared tooth, but we don't need to. So again, we'll try this
You've got
back on, and like that. And it fits that arch fine. It seats completely. And then what we want to do is now test it on the opposing arch. So you want to do one arch at a time to verify accuracy. And if we can just get it oriented properly, like that. And now we'll kind of look around the edges and see that it seems to seat all the way. There's no gaps. It seems to go all the way into place. So the next part is to try it all together here. Okay. I don't know what the patient's bite was clinically. It's all together, but this seems a little gapped over here for some reason, and I'm not sure. So let's do this now. Let's take this off, and let's just hand articulate and see how they come together. Now, see the difference. There's that's hand articulating. And the teeth do seem to be in a much tighter maximum intercuspal position with the bite record out. Now, a big part of taking an accurate bite record is clinically, at the time you make this bite record, having the patient close and test that they are indeed closing repeatedly and predictably into the same place every time. When you squirt that PVS material in there, you want to verify that indeed they're closing exactly the same way. I always like to take the study models out at that point, and with a red pencil or something to indicate the contact pattern, I'll put some Madam Butterfly ribbon in the mouth, allow the patient to tap together, and verify that that indeed is their maximum intercuspal position. That's their acquired bite. And then I'll make a couple of notes on their casts that, yeah, that's where the contacts are. So when I go to mount, I have a reference. I have something to come back to and say, yeah, it looks reasonable. It looks like the way they come together clinically. So when I see a mounting like this, and I don't, or a bite record like this, and I don't have a record of what the clinical contact pattern is, but when we simply hand articulate without the bite record in place, there seems to be a little tighter approximation than when this is in place. It makes me a little bit nervous. So I'm going to set this in place again, and then we're going to put it all back together and just see if maybe I was making a mistake with, no, I wasn't. So this is a situation, I believe, let's see here, it's very close. Yeah, so let's pick a couple of references here. It seemed like these premolars were closer together when we articulated without the bite record. So let's see if that's the case. Yes, they were, and the molars were closer together. You can see that this lower molar, these buccal cusps, fit very tightly up into the central fossa area of the upper molar. So what this is telling us is that the bite record is actually not accurate. So when the bite record was made, the patient closed, but not all the way. And so now the bite record doesn't help us too much. Fortunately, we have enough teeth that contact in maximum intercuspation that this is very stable, just the way it is. And so if this were to occur, we'd set the bite record aside. It's not going to help us. Clinically, the other thing to help verify the accuracy of your bite record is once it's made, put it back in the mouth and have the patient again close and see that those reference points all around the mouth are coming back together just the way they were without any bite record in place. And again, those are just different ways that you can verify the accuracy of your bite record. Have the patient close without anything in their mouth, tap, tap, verify that it's consistently in the same place, pick some reference points, the way teeth come together, top to bottom teeth. And then when you make the bite record and squirt that PVS material in there, verify that the patient closes in exactly that same way, let the material set, and then put the bite record back in place after you've taken it out and verify that they indeed are closing exactly the same way every time. So probably what happened with this bite record is the patient was a little bit open and it was not reinserted to check accuracy to make sure that all the teeth came together. That's the bad news. The good news is we have enough teeth to create an accurate mounting without the bite record. Now, if this was a case that involved a lot of prepared teeth and we were relying upon that bite record for the accuracy, we'd have to go back to the drawing board. We'd have to reappoint the patient, have them in, take the temporaries off, remake our bite record the way I just described, and then come back to the clinic support lab and do the mounting later. So the tops of these casts have been groomed, they're ready to go. They accurately hand articulate together, but we have to index the base so that they mount properly. So let's do that right now. We'll go over to the lathe and use this white fast cut wheel. It's very handy. It makes a very quick index on the base of the cast. And so I like to put, you can make any design you want, but I like to put, let's turn our vacuum on here. Very good. I like to put 3 grooves. 1, 2. That's a wimpy lathe. Something like that. I'd like them a little deeper, but that lathe is stalling out. So we'll take what we get. The reason you want these indices near the center of the cast rather than at the edges, you will see in a moment when we go to do the mounting. So something like that. Just some notches to help index that. We'll turn this off. We'll blow off the excess. And we'll go back over here to this part right here. So now this next part, before you do your mounting, it's important that you check your articulator. Make sure that all of the settings are appropriate. Now what we suggest for condylar inclination is 3, which is 32 degrees. So this is a little bit shallow, 4. So we want to put that right on 4 and then tighten that down. Make sure that this is tight. We'll come over to this side. If you had it like that, that just wouldn't be a steep enough condylar inclination. And so there's 4 on that side, and we'll kind of get that in the light, and then we'll tighten that down as well. So you want to make sure all of this one's loose over here. Just all of your settings are tight. Make sure that your articulator is working properly. And then for mounting purposes, we'll replace this flat incisal guide table with this handy little transfer assembly that goes right there. And we're going to set our incisal guide pin to 0, which it is at 0. We're going to get this out of the way. And then we're going to set, now if this, when this face bow record was made, if these were tightened securely, we shouldn't need any support. This is not a heavy cast, and so we should be able to mount this without the little T support. You can use that if you want to, but I find that it's just an extra piece of equipment. And if this again has been securely tightened and you don't abuse it by pushing on things too hard, that it all should work fine. So that's basically ready for mounting. The articulator is all set. We just have to put a mounting plate. And when you put these mounting plates, that's another thing to just take a moment and point out. Make sure that there's no debris between your mounting plate and the base of your articulator on both surfaces, so that they go to place very accurately. And then we'll take a, you can use a sponge or paper towel. We'll soak this. Just so that the surface of our cast is a little bit moist. That's kind of getting it started, but so now we'll get some mounting stone. Make certain that you use mounting stone for this. And one of the things that I did while I had the cast sitting on the articulators, I kind of estimated about how much mounting stone I would need. And I'll take our mixing bowl. That's lab plaster. Do not use lab plaster. Here is mounting stone right here. So we'll use mounting stone. And that's going to be plenty to mount with. Let's see, a mixing spatula. Very good. Okay. Excellent. So this is one where you don't have to worry about bubbles. You're basically using this as a glue. I'm going to get a wet paper towel to help me. And we'll add the water to the powder. We want to keep the consistency fairly on the thick side. Just a little easier to control your material. I wouldn't get it any thinner than that. You don't want it runny. And it probably, again, it could be a little thicker than that. I think it's thick enough, so we'll go ahead to the mounting. Let's bring our dry paper towel with us. And you want, like I say, you want the surface of the cast moist but not puddled wet. So if you've got any puddles, you do want to take those off. And we'll start by just flowing a little bit into the mounting plate. Try to just keep it in the center area. You don't have to take it everywhere to get it all over, so something like that works. And then we'll do the same thing right in the center here where our indices are. It's always easier if you go up rather than out, because the material wants to go out with gravity. So build it up rather than out. I have the stone. It's going to be in that index. That's all I need to make the connection. And now we'll rotate this to the closed position and then just lightly tap it to place like that. And that's all that you need basically to mount your upper cast. If your indices were at the corners of the cast, which is one method of mounting, and it's a nice method, I don't have anything against that. It works very nicely, especially if you're going to groom your casts and you're going to sand them and make them nice and pretty for presentation. But for cases going to the laboratory, this is a little more efficient way to mount. And the nice thing is, if for some reason your mounting is off and you need to remount, it's very easy to insert a blade between your mounting stone and the base of your cast and separate them and then remount to make it more accurate. So you just want enough stone to connect the cast to the articulator and then let that set. Now the nice thing about a case like this, where it's the lower arch, that's where the solid model is coming back from the laboratory, this can all be done ahead of time. So the student can be working with the upper model and the face bow and get everything mounted so that when this solid model comes back, what we've just done is already completed and doesn't need to be a part of the mounting process. And then it just speeds up that step when you do get the solid model back from the laboratory. So we'll let that set up and then we'll come back to this. So we've given our upper mounting a few minutes, and I say a few, you want to give it at least 15-20 minutes to set up all the way. Obviously you can just check it with your fingernail there and make sure that it's reasonably hard. If you do it too soon, you risk having the mounting come apart. And this is a little on the early side, but we have a deadline, so we're going to try to get this done. And it's looking okay, so we can disassemble this. We can take that back. And we can also, let's see, we take this off. And we want to go back to just a flat mounting table. So we'll put that on. And then let's put our mounting plate, again checking to make sure there's no debris anywhere down in here. And then we'll set our mounting plate in place. And this is where this little handy dandy stand can be very, very helpful by just putting the condylar area right there. And in fact, it's almost easier to turn this around, but we're going to lower this guy right here a bit to flatten it out. So that's what that second pin is really for. And now this is about ready. What we need to do now is a very critical step in all this, and with this minimally set, I've got to be a little bit careful, but I want to take that off the magnet. And we want to secure these casts together. Now hopefully there isn't too much moisture in our casts to prevent us. I am going to hit it with a little compressed air to dry it out. So we have 4 big paper clips to help us with this, and we have a glue gun. And so again, you want to just get that into its very best, most stable position. Once you've got it, hold it like that, so that you don't have to move and take your hands off. That position is basically your hand's like a clamp. It's holding that together. So we plugged our glue gun in. Hopefully it's hot enough. Wow, that's long. Let's see here now. Let's express a little bit. Yep, we're good. So we'll put a little daub of glue there and there. And then we'll set a paper clip in. I'm going to add a little bit. Like that. And then we'll go to here. And here. Add a little bit. Try to keep your paper clips toward the side you've already mounted so they're not sticking below the trimmed cast that you're mounting second. And then we'll turn it over without letting go of our clamp-like hold. And oh, come on, stay put. I don't want to glue me to it, if I can help that. Okay, then you just need to get all the little spider webs from the glue gun off. Wow. Okay. I think that one's a part of me. There we go. Okay. So we make sure that we get all the little excess pieces off like that. And now this cast is secured. The lower cast is secured to the upper. Be very careful as you're placing this back on the magnet. Don't let it jump onto the magnet or it will sometimes dislodge your mounting. So we basically just want to carefully let it go back to place. And now we can visualize the amount of separation that we have and kind of the amount of stone that we're going to need for this next part of the mounting. I've got a soaked wet paper towel, and I'm going to just give that a little head start with the water, and then we'll set this like that on there and go mix up our mounting stone. In terms of the amount of time that stone cast needs to soak, it's just a minute or two. It's about how much time it takes you to go get your mounting stone, mix it up, and go back and mount. This one looked like it could use a little bit more than the other one, so I am going to use a little more stone this time. Probably have too much, but too much than not enough. Yeah, we got plenty. So again, just enough to incorporate, and you want it so thick, you don't want it to just run out if you tip it over. You want a little body to it. Come back to our case. We'll take our wet towel off and we'll do a little bit of blotting to get that film of water off.
Yeah, you're good.
Okay. So let's, again, we're going to drop a little bit into the center. And you only need it in that center area. You don't need to get it, in fact, you don't want it up over the edge. You don't want it around here. It just makes for a messy mounting and an extra stone that you now have to kind of clear away. So something like that. And then we'll go to the opposite side here. And again, keep in mind, stone has a tendency to slump and settle, so up, not out, up like that. And we got to go a little more on this one because it's got a little bit bigger of a gap. If the gap is too big on this second mounting, it's not so critical on the first, but if the gap is too big on the second one, I will often do it in 2 steps where I'll add enough stone that it won't quite touch, but not on the mounting plate side. I'll just add it to the model. I'll flatten the top of this off so that it can set like that, And then when I go to actually make the connection with the mounting, it's just a little bit of a gap. And the value in doing that is, and I better get this closed and I'll explain that value. So we'll bring this together, and again, just drop that until that goes to place, and just verify that you have it covered like you need. We don't need that there. So we'll kind of scrape off the excess. But even mounting stone expands a little bit. So all stones expand. And the greater the volume, the more expansion you're going to get. Let's see what it looks like on the back. It looks fine. So that's basically, that's it. We would now just allow this to set up, make sure that this is all the way seated, that the guide pin is touching on the guide table. And at this point, just allow it to set. So getting back to why you might do this mounting in 2 steps if it was a large gap. And the reason you'd be doing that is to accommodate for the expansion of the stone. Again, the more stone you have, the more expansion you're going to get. And the more expansion, the more inaccuracies with your mounting. So if you can let the lion's share of that stone set without the pieces connected, then that expansion has taken place in midair and it hasn't interfered with the accuracy of your mounting. Now all you need to do is come back and maybe add that much stone just to connect that bit that you built up with the mounting plate, and now it's a much smaller volume of expansion, and hence you won't have the tendency for error to creep into your mounting. So that's it. We'll let we're back. We've allowed the stone to set with the lower mounting, and now we're going to take it all apart. So let's take it off of the stand here and get. So we have allowed our stone to set on the mounting, and we've removed the articulator from the stand. This little guy over here, our stand, and we took off our paper clips that we had stuck to the sides to secure our upper and lower models. And now what we do is verify the accuracy of our mounting. So if you go in with a little, and I'm going to get the guide pins out of the way first. Remember this pin was up when we mounted, okay? So that's in the up position. We're going to get the incisal guide pin off the table so it's tooth to tooth. We know that it's teeth, it's only casts that are contacting. We want to see how that contacts, and then we would compare this with what we had recorded clinically to see if it was similar. Now, I don't have the recording chairside of the way this patient's teeth came together. But if I did, it would help me now as I look at the contact pattern, and you're welcome to come in close and look at this, and see where the upper and lower teeth are touching. In that I don't have that record, I'm going to leave this one alone because I verified that we do have a good contact right next to the preparation. So we've got a good contact here and here, and we have reasonable contacts in other areas. Are the canines and maybe this premolar and some of the incisors likely touching clinically? Yes, they probably are. And if I had a recording of that and I was more confident that I could improve the bite to better match the actual clinic situation, I would do it. The problem now, if I was to go ahead and grind, carve away these contacts, is I might bring the casts enough closer together that now when this crown is made, it will be a little low. It would be an infra-occlusion. I'd rather have it be slightly high so that I can adjust it out, because you do not want to cement a new crown when it's the distalmost tooth in the arch in infraocclusion. That can cause problems with the masticatory muscles. So what I'm saying is, in a nutshell, I'd leave this one alone. But it is not a bad idea to get your Tanner Carver, your discoid cleoid, whatever you debubbleized and groomed your casts with, to sometimes improve upon the contact pattern of your casts in the final mounted case. The reason we do that is, as you're well aware, by the time we're at this stage, everything is a copy of a copy. So we've taken impressions, that's a copy. We've now poured up casts, that's another copy. And as you know, with each one of those copies, we begin to lose a little bit of accuracy. So this is a stage where you can do a little course correction if you need to just improve accuracy. Again, with what we're seeing with this contacting pattern, I would leave it alone, but there are some where you don't. So at this stage, then, this entire case is ready to be returned to the laboratory. They have the die model. Now they will have the solid model accurately mounted with a relatively correct occlusion for the patient. And so this is ready to go back to the lab. Thank you.